first name is Karen, and I came in with chronic right hip SI joint pain and cranial bones that were off from an impact to my head, and gave me a lot of eye problems and sinus congestion and occipital or back of the head pain. And
can you describe that hip injury?
Yes.
The force that created that?
Yes, the force that created that was riding a bicycle that the brakes failed, and instead of going into traffic, I turned and went into a wall. And with the leg bent, the hip bent and the leg down, I very strongly hit into the wall and it jammed my entire pelvis backwards. And from then, I've always had chronic issues, and that's been 50 years ago or more. So, yeah. And then remedies attempted for that have been multiple. Being a physical therapist assistant for all these years, I have been able to continue to be functional and reduce the pain, but it's never gone away. And over time, degeneration of knees has been something that came about, and my walking, my gait was significantly affected as I tried to keep going, and then that pain and dysfunction and compensations increased dramatically, and pretty much have had continual discomfort and inability to stand completely upright and hold that. Was always leaning forward. So those were the effects that came along with that. And so I've done exercise, massage therapy, chiropractics, acupuncture, and just everything I have in my arsenal of knowledge of physical therapy to keep going. And during the treatments here, when we would reach what was perceived as a discharge of the energy or the pain, I would feel corrections happening, meaning the positioning of my sacrum to my hips and all that stuff were just naturally going into their correct home base. It just kept feeling it was going back home. And with that would be a sense of ease and lessening of discomfort.
Can you describe how the pain increased and then abruptly?
Yeah, so it would be something that was not there, but familiar when it started to come on, and then it would get to where it would grab my attention, so I knew the intensity of it was coming up, and then it would just, something would either start to move, or I'd feel like a strengthening or a relaxation, and there actually was, I feel the movement of the sacrum going into it, and then out of it, and then into and home. Or, trying to describe what it felt like.
A lot of involuntary movement.
Yes, I wasn't having it happen. It was just doing it like I knew what to do.
Mm-hmm.
Yeah.
And each time the pain peaked and suddenly let off?
Yes.
Okay.
Each time. Yeah. And it just left with a left me with the feeling of, oh, thank goodness. Yeah. Yeah. It's not something I could achieve on my own. That's for sure. Yeah.
Okay.
Yeah.
And walking around now?
Walking around now, as I just left the office to make a stop and come back, I was walking faster, more alignment, had better weight bearing on this leg, and more power through this area, which is miraculous, to say, for lack of a better word. It's not something that I could achieve with everything that I was doing. And then there it is.